Hi everyone. Today I'll be discussing about most commonly used in the dentistry radiographic technique, that is OPG or orthopanoramic imaging or panoramic imaging. So this OPG is discovered by Numata along with this Pataro. So these are the persons who discovered this OPG, and this is an old picture when the first OPG was taken with whatever the device they had discovered. So the patient was sitting, and the cassette was placed in front of the patient, X-ray source behind the patient. Okay, and this was a radiograph of first OPG, which was taken for a maxillary teeth, and this is for mandibular teeth. So it's about continuous exposure for about 15 minutes for mandibular arch. So this how you get, suppose you take a lateral step and PA view. So if you club all this, you're going to get a OPG image. So what are the indications of OPG? So if you want to know the cystic tumor site, size and extension, so first one indication will be that in oral medicine. Apart from that, if you want to know any fractures in the middle third, mandibular fractures or anywhere else in the face, and to investigate the TMJ problems, you need to go for OPG. And if you want to evaluate any developmental changes, if you want to see, need to go for OPG. And in mixed dentation, you want to see the tooth development, you need to go for OPG. And you want to construct a CD. Before constructing a CD, you need to check any bony fragments are there or not. Okay, so and one more most important thing is to assess the age estimate in oral medicine. It's the most commonly taken radiograph. So in surgery, you want to assess any impacted teeth or supernumerary teeth, so you need to go for OPG. So even surgery, if you are doing any surgery, before doing any surgery, so you need to take and check the lesions. And if you want to compare pre and post operative sites, you need to go for OPG. And before placing implants, the most important thing is you need to determine the vertical height of the alveolar bone. So to determine the vertical height, you can go for OPG initially. And to assess the alveolar bone in the periodontal ligament disease, pedial diseases, so you need to go for OPG. And orthodontic treatment also you need this. So where all this OPG is not suitable, so the patients who cannot stabilize for a few seconds, about 14 to 15 seconds, we are not able to take this OPG, and especially children under 5 years of age, so you cannot. And for handicapped patients also, this is not possible. So what are the principles of OPG? And before going to the principle, okay, we need to remember this. We are using the vertical narrow beam in a slit diaphragm or slit collimator in OPG. So when you want to know the OPG principles, the OPG principles can be determined or explained in two planes. How we are going to image the object in two planes. So one is projection in the vertical plane, another one is a projection in the horizontal plane. So when you project the object or tooth or any this thing, so vertically, so basically you are placing the film and inside the oral cavity, and object is there, extraoral site is there in case of IOPA film, IOPA techniques. Whereas in extraoral radiograph, what we do is the same technique which you use, but thing is the cassette is placed outside the oral cavity instead of a IOPA film. The X-ray source will be rotating around the patient head, and we take a imaginary center, okay, that we call it as a functional functional focus or rotation center, which is there in the oral cavity. So when you get the image of vertical dimension of image, so that vertical image is not affected by horizontal rotation of the beam. So X-ray source will be rotating around the patient in a horizontal axis. So even though horizontal movement is there for X-ray source, vertical dimension is not affected. So because the vertical dimension of any object in what we get in OPG is mainly with whatever the conventional radiography technique which we use, bisecting or paralleling, whatever. So focal spot which is there in the X-ray tube serves as a functional focal spot for this vertical plane. So function spot in X-ray, focal spot in X-ray tube which serves as a function spot. So when you imagine vertically, so there will be a slight negative angulation beside the or beneath the occipital portion of the skull. It's around -4 to -7 degrees. And one more principle, that is the projection in the horizontal plane. So when you get the image of an object in a horizontal plane, so the horizontal dimension is going to be widened here. So because the rotation of the X-ray source is there, teeth are stationary, film will be moving in opposite direction corresponding with the whatever the X-ray source. So X-ray source moving is in clockwise direction, X-ray film is moving in an anti-clockwise direction. So as a result of this, so we could able to see the image in horizontally, that object size is going to be distant. We imagine that rotation center has an effective focus of projection instead of focal spot. So instead of focal spot, we take this rotation center which is imaginarily located in the oral cavity, so that we take it as a functional focus for horizontal projection. So that we have to keep it in mind. So here the center of rotation, that is effective focus of projection or center of rotation, is the functional focus, okay, for horizontal imaging of an object. So as X-ray diverges from the intraoral source, so that will be taken as a function spot of a X-ray tube in a horizontal dimension, but actually that is not. So in this picture you can see this stationary rotation center is there, okay. So X-ray source is coming, and the lingual aspect of a mandible, on the right side of the mandible the rotation center is there. So the X-ray source are passing to the film, and the film is moving in a anti-clockwise. The X-ray source is moving in a clockwise direction. Tangential to the X-ray source will be always tangential to the rotation center. So that we need to keep in mind. So this is an image which is showing how the image is going to be captured. So the starting here and the position 1, 2, 3 is shown. The X-ray source is passing from the right side of the mandible tissue patient. So you can see the rotation center is located here, and whatever the image is captured here you can see in the film. And from the position 1 it moves to the position 2. So we can see this, how much is a image is formed, that is shaded one. And when it comes to the position 3, from rotation 2 to rotation 3, so you can see the almost half of the image is captured. So here left side of the mandible, left side of the face of the patient is whatever it is recorded in these 3 movement pattern what is shown in this radiograph. So So this is how the image is captured segment by segment in a film, and this is the opposite side of the patient. But from 3 it will move to the 4, from 5 and 6. So as a result you can say this the image is whatever it is there completed. So here one more most important point thing is focal trough. It is a 3-dimensional zone in which objects are well defined with the sufficient details and sharpness. Okay, so vertical dimension and horizontal dimension match only when the object lies within this central plane or focal trough. So it is horseshoe shape. It is having the height, width and length. So the objects which are located outside this layer are sharply depicted, but still within the image layer they are always somewhat distorted in shape. So when you see the width of the image layer, so we know that the rotation center is located. So the width of the image layer will be decreased when that effective projection radius is less. If the effective projection radius is more, you can see the width of the focal trough is increased. And here, if the width effective projection radius, if it is less, so width of the focal trough is going to be very less, and effective projection radius is more or away from the rotation center, you can see the more width of the focal trough. So here how you need to remember all the earrings, necklace, all those things, and you need to instruct the patient to stand, close the teeth, clench the teeth, put the tongue out, touch the palate, okay, stand upright, all those things. And you need to check the Frankfurt horizontal plane. And when you take a radiograph, there will be 6 zones, zone 1, 2, 3, 4, 5, 6. So when you see the radiograph, you need to see these particular segments for whatever the information which you want to evaluate. So the 6 zones are there. So there are some indications for OPG. Most important one is broad coverage of the facial bones and the teeth, and in a single film you can get very fast and it is very simple. And the dose is very less and less time required, and it is useful in trigger gagging patient, trismus patient, and it can be used as a teaching aid. And it is useful for mask screening, and you can easily compare the condylar rates, and superimposition of analytical structures is very less. But there are some disadvantages which you cannot come out. That is overlapping the proximal surface of the premolars. Okay, that will always be there, and overlapping of cervical spine. These two are not unavoidable, and the sharpness is poor because we use intensifying screens in this one, and you get the ghost images, artifacts and soft tissue edge shadows, and lastly OPG machine a bit cost.